A1, and in fact debating a sub-amendment put on the floor by somebody.
According to our record, we are still on amendment number the sub-amendment A1 moved by Honourable Member for Calgary Mountain View.
Okie dokie, that's what I was checking.
Right.
Thanks very much, Mr. Speaker. Oh, great. Oh, yes. Okay, so this was around the... sorry, I'm just missing a whole great honkin' big file. This issue, or the sub-amendment, in fact, was around trying to take all of the references to public inquiry out. Oh my God, I can't read your stuff. In order to yeah, this was the one that had. Oh yeah, okay. I spoke to this before. Section 1, striking out Clause E is striking out the inquiry. Section 17 to 22 inclusive are those sections that discuss and give authority for hearings. So 17 is authority to establish an inquiry, 18 is hearings, 19 is in camera, 20 is disclosure, 21 is witnesses, and 22 is reports to the Legislative Assembly. And then Section 23 is excluding a member of the panel, and Section 25 is very similar to that. So we have, what we're trying to do there is make sure that the inquiries would be conducted as an inquiry under the Public Inquiries Act. Part of the issue that is important in this section is the issue around the ability to go in camera. And members opposite have raised my concerns on the record, which are numerous, around personal privacy. And the government appears to be wanting to give itself the ability to go in camera to protect people's personal medical information, if that in fact would become a point under the inquiry. And what I want to argue back is that there's two sides to this. One is which I think it's really important that the public is able to look at the information that any committee, government committee or inquiry committee in this case, and be able to look at the same evidence and reports and submissions that the committee or inquiry or panel did, to understand how the committee came to its final ruling. And I have always insisted and have brought forward a motion, each of the standing committees on policy field committees, when we are examining, reviewing an act, for example, or reviewing something that's put before the committee, that with both the in-person submissions but also the written submissions, that they are to be posted to the public website. And if someone says, no, I don't want my thing to be posted to the website, then the answer is, thank you, but we won't be using your submission as part of our considerations in rendering a decision. So I think what I'm trying to say there is I think it's really important that what we do is available publicly and holds that transparency part in it, so that any member of the media or the opposition or the public could look at something and read the same things and go, okay, I get it, I understand why they came to that decision. The other side of that is the personal privacy of medical information. But we here are talking about a situation in which a situation of such magnitude that it is requiring either an inquiry under the Public Inquiries Act or, in the case of what's being contemplated under Bill 24, the creation and establishment of an inquiry-like panel under the auspices of the Health Quality Council. And if we are dealing with a health issue that is that critical, my experience has been that people that bring forward medical information there want the information to be shared. They want to use their personal medical information or the medical information of a loved one as part of the educational process in moving forward a particular change in how we do things, or as part of an inquiry. And I think yesterday I got cut off, but I had started to talk about some of the well-known, let me call it, group it under medical issues that this Assembly has dealt with over the years, and that have in fact resulted in some of the fatality inquiries that we've had. But certainly the most a really good example of this was Rose and Rick Lundy, where Rose Lundy had suffered a miscarriage in the ER in one of the Calgary hospitals and hadn't received what both of them felt was a dignified response to her medical treatment. And you know, so that one wasn't going to result in a whole bunch of huge changes. It did result in particularly Rick, I think, participating in some patient concerns committees that were around changing how people would be dealt with in ERs. But there's a perfect example of someone who wanted to take their personal medical information and use it as part of a process to change public policy. And I would submit to members of this House that that's exactly what I would be expecting to have happen under Bill 24. Or, in fact, under a public inquiry under the Public Inquiries Act, because people are saying there's a problem in the system. Here's an example of how it affected me. Here's what happened to me. Here's my story. Here's my personal medical information. That information gets shared, and it's part of what somebody feels others need to know as a way of changing the public policy. So, and I know, yeah, I'm coming to that. The Minister of the Department of Human Everything, I'm sorry, that one won't stick in my head. Human something, services or human everything? Okay, human everything. Is saying, well, you know, you can't say that that's the way it's going to be with everybody. But as I'm constantly told by my colleagues on the other side, you know, this is about balance, and this is about, you know, finding the best way through this. And I think we do have to say this has to be a transparent process, and therefore everything will be published or will be available. Two, you know, we want you to bring your stories forward if you're trying to change public policy. I'm really struggling with the idea that someone could bring forward personal medical information in private. The committee would meet in private, in camera. That's what that is. It's out of the eye of the public. And make a decision that would change public policy, and nobody would be able to know why. And yes, okay, if I'm going to be held at fault, I'm going to be held at fault because I'm depending on people willingly participating in a public process. But I think that's important. And nowhere in here am I saying, and do not accuse me of this because it's not true, it's not what I'm saying, that anyone would be forced or would be outed with their private medical information in order to participate in this process. That's not what I'm saying. But I am expecting that people that are going to come forward here are going to be willing to have that discussed in a public way. Bottom line, if they're not willing to, you know, can privacy be offered to them? I'd really have to question why. Because I'm really concerned about a lack of transparency here. No, I'm not willing to force them into outing their personal medical information if they really don't want that to happen. But I'm also struggling to think of where that would be likely to happen, and I just have not run across that. Maybe my life has been very narrow, but I've done a lot of work in health information, in protection of personal information, and in the FOIP Act. And I'm just not running across that. People that want to change public policy are more than willing to discuss that. So that's what's being anticipated under the amendment brought forward by the member for Calgary Mountain View, and I definitely am in favour of that. And I'm going to let others speak to this amendment. As part of this process, it's really what we're attempting to do here from the official opposition is to make this act better. The government has the votes to pass anything they want to, and if they're quite determined to do it, they're going to do it. So, you know, some days I walk up the hill to this building to do good, and some days I walk up the hill to this building to try and have the government do a little less bad. And with Bill 4024, I'm trying to have the government do a little less bad, because I am one of the people that believe that a certain thing was promised by the Premier and that we are getting a different version of that. And I've yet to receive a compelling argument from government as to why they refuse to give us what was promised and why we've had a replacement put in front of us. So I will leave it at that and thank the Speaker for the opportunity to speak to members. Thank you very much.